What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted.
Hi everyone, Dr. Steve Rasner here, and welcome back to the Lionhearted Dental Podcast. You know, I don't know if you're supposed to say these things, but I know that we are about a week out from Thanksgiving, and this year is pretty much in the books, meaning you probably, like myself, already have a lot of patients scheduled in the remaining 5 weeks, and that's okay. Maybe, I want to tell you this, it's all okay. Maybe you meant to do some of the many things we've talked about this year, but you didn't get to them. So what? I didn't start training in implant dentistry until my late 40s. I didn't start speaking until right about the same time. There isn't many things you could possibly say to me that I couldn't help you with, either through a phone call conversation or emails or whatever. I've done it for many of you, or direct you to somebody that could help you better than I could. So who cares if you haven't got to it yet? Let's not waste another year in getting you to where you want to be. I had a beautiful podcast set up for you tonight, very organized. It was called, Have You Ever Thought of Your Practice as a Place of Business? And then why would people want to come back to you or come to you in the first place? I love it. I don't think I'll get to it because we're going to call this one of Rasner's rants. I don't even know where these thoughts came from, but what I do know is that most of you will be able to completely, if nothing else, you're going to be joyful that you're not alone. Let me enlighten you. The best piece of advice I could ever give any of you is kind of a spin-off on the podcast I did a few weeks ago called That Confidence Thing. And the advice is, believe in yourself. And do you really do that? And there's no doubt that many of you don't. The question, that's fine. The question becomes, what do you need to do? Are you willing to do the work to believe in yourself? Why wouldn't you? Look, I don't think my podcast is for burned out doctors that hate dentistry. And obviously, I can't give advice to 100% of you. I think this podcast attracts a lot of doctors that are doing well and want to do more. I really do. A lot of young doctors especially. And so you have time to change the things to change your confidence, man. And look, it can go, like I said in that last podcast, in one day, not forever. It's easy to get it back once you've had it. But the reason I start with that, and I may actually start my live 2023 Lionhearted weekend with this talk, because I know that it resonates so boldly with so many of you. Let me run this scenario by you for a minute. You're not going to love it. You train, meaning you take CE. And can I be clear about something? If you're going to take CE the Lionhearted way, it's not 1 or 2 courses a year. It's a continuum. We've talked about this. Many of you have asked for my Lionhearted recommended residency post-graduate school, post when you graduate dental school. It's what I did. It's an updated version of what I did. But I took at least 1 course every quarter of the 4 quarters of the year, and I pretty much still do. And one of them is either a continuum that is in process for a year-long course or longer, or it's like a 3-day hands-on thing. I rarely take just 1-day courses. I can't say never, because some of them do attract me or I find attractive. But just humor me for a minute and listen to where I'm going with this, because I know you're going to be able to relate. So some of you have trained, or you're on the beginning journey of that Lionhearted training protocol. And it's hard. You miss weekends, you spend a lot of money, and you even implement things that I stress that you should do, including, most importantly, the comprehensive examination. Right? Let me deviate for a second and say this to you. Do you know how successful my implant course treatment plans are? They're 100% successful. Every person that I recommend an implant to in my implant courses, I'm talking about the patients that participate, accepts exactly what I recommend. 100%. Do you know why? It's free. They don't pay. That's why. Herein lies the problem with you and I. And it's doubly painful. When you're an honest, great clinician, not a good old Joe, but an honest, great clinician, it is easier to lose patients that way. And what's doubly hard is you take these courses at the Spear Institute or COIS or wherever you're going, Dawson, etc., all great places. And you get back and you are high as a kite in the classroom when you're out at these courses. And then reality strikes back in when you take your long plane ride home. Get back in your car for Monday morning, and lo and behold, you have your first new patient. Number one, you probably don't have enough time to do the proper exam. But that's not even the major problem. The major problem for you and I is that almost every patient I have ever worked on, now I don't know the percentage, 80% at least, have less money than they actually need to do the case the way I'd like to do the case. How many times would you do ortho on a case if the patient would accept that? So sometimes it's a must, right? There's no doubt you have to do ortho. I have a patient like that right now. She's 70 years old. She wants an aesthetic makeover. I did her whole family. And she's the last member of that family to come to me. She probably did not like me for years and years, probably thought I was highly expensive and overpriced, as she watched family member after family member, and I mean a lot. She was always a doll to my face. I would see her at her beautiful box at Lincoln, where the Eagles play. I can't think tonight. That's why it's great to hear me after I work, because it's real. I can't even think. I can't even think of the name of my 8-0 Eagles National Football League team stadium, but I see her there because they're very successful people, and they invite me to go there. But she finally came in, and she wants her mouth redone, and she needs a lot of stuff. Here's my point. It's intimidating for most of us. Can you imagine what it must be like? One of my friends from dental school graduated in the top of the class, like top 20. And he got a job 40 years ago, 42 to be exact, with Dennis Tarnow. This gentleman became a prosthodontist, my colleague. And I would bet you in that kind of practice that the percentage of patients that say to the doctors, I can't really afford that, is extraordinarily low. So you and I have the added burden. I don't even know why I'm telling you this, except I had this conversation with my great colleague and associate, Dr. Gabe Ruiz. I don't know if I'm allowed to say that. I never had an associate like him. I've had great ones, but not one like him. And we have really honest dialogue, random sometimes, after one of the days we work together, because he has his own gig up in North Jersey. And we had this conversation. And the conversation was exhausting. That's always a factor. The burden is that you and I have to come up with a treatment plan most of the time, not half the time, most of the time, that is somewhat compromised from what the ideal would be. Now, sometimes you can't do that. You've heard me say this to you. Sometimes you have to treat a patient with a collapsed vertical dimension of occlusion, and you certainly can't do the right side and leave the left untreated. I guess you could. I've held vertical with composite resin for 7 years before. I have. I mean, there's a big difference where I live with crowning, full coverage crowns on number 2 through, let's say, 11, and then another 12 through 15, 4 more crowns, $2,000 each. I have practiced for 42 years in an area that it's incredibly rare that somebody just lets me do whatever I need to do, like the patients that go in my implant courses. It's just true. And I know you have the same thing. And so the problem with that, you and I tonight are definitely having a beer together. Go in your refrigerator and go grab one. I could use something more than a beer, but I'm doing a podcast. So what do we do about it? Well, what you can do about it is that you have to know where the line is that you can't violate, and you can never be intoxicated by the amount of money of the compromised case. So let me elucidate that. I've done this before with you as well. Let's say that it's the 4th Monday of a month that is your worst month of 2023. And you have a new patient on the schedule, and they came to you for implant dentistry. And they want a lower implant. Let's take the most inexpensive thing there is. Zest locators, no bar, and they can only afford 3. 2. You can't do that case. Not in my world. You can find a study, my friends, that'll support any kind of case that you can find in your clinic. 2 implant overdenture on the lower. Do you really think that's a good idea? Or let's say it's a patient for implants, let's stay on that subject, that has a host of morbidities. He smells like smoke, but says he smokes not even a half a pack a day, a couple cigarettes a day. He looks like he's a drinker. He's a borderline diabetic, maybe a 7.2 H1AC. He has perio. And let me back up to the last case. The last case had 10 of the 14,000 the case cost. Right? Are you going to do it? And the second guy I just said to you, he's got all the money, but he's a highly predictable failure, and one you're going to manage for years and years. And I will tell you, I've never been guilty of the first, but I have been guilty of the second. So whenever I had a patient that could afford 2, I just did the third for free. Shoot me. I don't know what to tell you. It's true. I never under-engineered a case to save money because I didn't get paid. If I took the case, I did the case. To be honest with you, if it's locators, it's 4 implants. I've done a lot of gratis implants on cases I realized on surgery day I under-engineered, and I've never regretted over-engineering them. I'm telling you now, I wouldn't feel guilty about that. If you were on your fourth Monday of your worst month of the year and a patient came in and they can only afford 2 implants, then do the third or even the fourth, especially if it's a Zest locator case. Obviously, you can't really do a bar on 2 implants. You can on 3, but the bar adds significant cost. But we find ourselves all the time, do we not? And I'm just talking about implants right now. It's easy. In this dilemma, do we do the case or not do the case? And if we do the case, do they positively understand what they are getting and what they're not getting? Because fees are a problem. And I know, I'm not backtracking. I've gone on the air many times with you, and I've talked about segmenting cases when you can. You certainly can't segment an overdenture on a mandible. You can't. That would be ridiculous. That would be going to extremes to get a case. I don't want to talk about that. It's silly. But you certainly can pick out in a case that's balanced occlusally. Yeah, you ever go to a patient? So I'm bringing up a lot of things because that's why it's a beer talk tonight. Maybe I'll call it beer talk. And the patient's got pretty good perio, but you look in their mouth and they have multiple, as I mean like 10, MOD, BL, MOUSE amalgams. I mean, you can barely find tooth structure. By the way, they're never symptomatic, right? They're there because they chipped a little piece of something. It doesn't hurt, and they're completely unaware of the failure level, which is another bonus you and I got from choosing dentistry. Couldn't we have chosen a profession where early perio hurts and they can understand the benefit of going to your office 3 to 4 months, very often 4, for the rest of their lives, even though insurance does not cover it? As I'm speaking to you today, I find myself back in operatories with various patients in this exact scenario that I'm describing to you. And the key for you is, if you do compromise a case, number one, because of cost, could you defend that case in front of your board of dentistry? I mean it. So the case fails. Maybe you did a bridge from 21 premolar, lower left premolar to 28. And, they have parafunctional wear. I don't know. I've seen everything in 42 years. Could you defend that? The answer would be no. So that's an easy guiding principle for you, a guiding light, that if this is because we're alone. And we see a lot of patients each week, do we not? And sometimes it will happen to you. You will get caught up in a moment and do something, not even for money, and go back one day, years later, and look and say, what was I thinking there? Maybe you crowned a very short endo. Here's a good example. That was 7 millimeters short of the apex, completely asymptomatic, no periapical lesion to be found anywhere. I mean, the proper protocol, in my opinion, would be at least to see if an endodontist or yourself could redo the endo. Why? You can't assume it's fine because it looks fine on the particular date you're looking at it. There's so many instances that you and I fall into in this profession that we chose. And we're alone often, making decisions based on the best we can be. So could you do that? And if you do compromise the case because the patient only can afford whatever, you better be sure that it's not only verbally crystal clear, I bought a $1,500 tape recorder that's on a stand like they use in professional settings to start taping my conversations. You know when I bought it? I bought it 10 years ago. It's still in my office. I never got up the whatever you want to call it to implement that because I get tired of one patient even remotely implying that the treatment was different than I had told him. I only need to hear that once in my career. And it's happened. I had somebody who asked me at the insert, "You mean this isn't going to be fixed? This comes in and out?" Even though I had it documented, I didn't have it on tape, that they never had anything fixed in the 7 months I was working on them. It's the first time they ever even mentioned it. So be sure that you verbally and you learn to communicate in a proactive way what you're not treating. And if you can segment treatment, there's multiple instances where it certainly can. You can, back to the patient I was alluding to 10 minutes ago, with giant amalgams, you can pick the word, hopefully they're in the same quadrant, and if they're not, then they're not. You can only do the best that you can do. And I've done that. I've done number 14 and number 30, or 14 and 19, because they were clearly the worst in their mouth. And I do have patients that I transitioned and segmented very, very much in the 90s to quadrants of gold, inlays, onlays, and they remain my best patients for the rest of my career. There is something to be said. I'm telling you, it's the most successful, enduring procedure I ever learned in my career, and that would be restoring posterior teeth. I mean it. It may be laughable. I don't know where your head's at to many of you, but it ain't laughable when they come in for a recall, man, and their mouths, the restorations you did look brilliant. Years and years and years later. And I've never had one patient. And what happened is I got indoctrinated to Bill Strupp in Clearwater, Florida, who it wasn't just gold that he liked. It was indirect restorations, which you've also heard me talk about on this podcast. There's nobody listening that can do a direct clinical chairside restoration as good as a well-executed indirect restoration. That's why they're the best restorations, whether it's gold, ceramic, or one of a variety of crowns that we can provide today. So I'm a little off track. I was telling you why it's so difficult to be us, why it's exhausting. You should show this video to your wife or husband, or maybe even your staff, because I don't know that anybody gets it other than us. And I've been doing this 42 years. I'm the one that professes this is the best profession possible. And that is the reason that I feel that way is because I've been able to develop a number of strategies to minimize the other bumps that you and I come across in the practice of dentistry. That's why my staff training is so critical. That is why, as exhausted as I am, and I'm on the brink of having back surgery a month from today. Is it a month from today? I think it is. And if you look at me, if you can hear my voice, then I'm exhausted. Pain is exhausting, my friends. And despite that, I called for a meeting with my office last Monday, and I reminded them that we are not performing like a Super Bowl team. And I gave them vivid examples. And I told them before I said it, that some of you are not going to like what I say. And everything I'm saying to you doesn't apply 100% to everyone, but it does apply to some level to all of you. And I can't be up here worried about your feelings right now because we're not executing well. I'm not proud. I like to be the best. I like to be the Super Bowl champions of where Southern New Jersey patients can go and feel the value that they pay us for. And I'm going to give you a number of examples where I don't think that's the case. From follow-up calls to patients the night after treatment, not all treatment. You got to use common sense in things. A root canal we did, an extraction, which we do lots of in my office, the insert of a big case. We don't call inserts of single or even double units of crown and bridge. We don't call on night guard unless it was put in to alleviate acute TMJ dysfunction, which I don't even do much of. You know what the takeaway here tonight is? The takeaway is acknowledge for both of us what we chose. It's hard. When I was going to the back doctors to figure out what I was going to do with my back, they didn't give me 5 treatment plans, and certainly none of them were based on cost. And I know it's medicine. They gave me the best options according to their diagnoses. You need to run your business that way. You do. You need to believe in yourself. And if you don't believe in yourself because of your skill set, then we need to fix that. And we need to start fixing that in 2023. And it's fixable. Sign up for 4 courses, quarter by quarter. The first time you take a course for I don't mean a 1-day course, 2 days, 3 days, whatever it is, you're going to feel different. That difference is confidence. That's what you feel different. You can't fake that. And it's cool when you take courses because you collect other ideas on how to fix other arenas in your office to bring that up to quality. Because one of the things that we absolutely have to earn is the right for you to charge appropriate fees. I mean high fees, only if you've earned it. Because if you haven't done that, it takes the air out of everything I'm talking about. If you have to lowball your fees because you don't believe in yourself, are you better or not than the competition in your area or the most dentist? And if you're not, let's train. Let's get there. I got there. You know where I ranked in my class. And there's a lot of other footage to fill in here. The execution of an organized day. Those of you that are on the track for super GPs, I need to talk to you to tone it down a little bit. I mean it. The problem with being a super GP is that you expose yourself very much to failure because you're doing high level things. I've gone on here a million times and said, you can make an amazing career in implant dentistry of doing abundant bone cases, thick, soft tissue cases, working between the foramina, never coming close to doing a lot of the things I teach in my institute, like sinus lifts, horizontal, vertical augmentations, all the soft tissue procedures that we teach and have to learn as well. You don't have to even do all that stuff. And you'd still have an amazing practice, but you got to become great at something. Now, what's that great going to be? You want an easy one? Oral sedation. It's the easiest one I could ever give you. It's not even skill. It's learning the protocols of what you should do and not do. It's the truth. And people will seek you out, even if you're an average dentist. They will, because of that. I think this helped. I know it was kind of random. That's why I called it Rasner's Rant. It was good having a beer with you. I have to get mine after we hang up. I hope it helped. I am going to do the one next week on, have you ever thought of your practice as a business? And why would people come back to you? And I'm going to give you the reasons why. Here's a little hint. Think of the reasons you return to the businesses you go to. Thanks for hanging in there with me, guys. Send me some prayers on Friday, I think it's December the 9th. I'm pretty sure I'm going to be under the knife. I won't be down very long, so I'll be okay. Thanks. See you soon on the Lionhearted.